Welcome to the simulation room here at South Dakota State University. What I want you to do is watch this movie so you get an overview of what the sim room is like. First of all, what you need to remember is that you need to come into this room and introduce yourself and talk to the sim man. That's the most important part. The sim man will answer you back and he will interact with you, so you need to make sure that you communicate with him or her depending on the situation. You also need to be aware that there are some supplies in the room that are usually on this shelf. You can take a minute or two to look over to see if there are supplies that you will need in the room. So let's say you've assessed your patient, bring your stethoscope, do your assessment. If you do need to communicate with other members of the healthcare team, we have a phone in the room. So what you need to do during your simulation is you need to pick up the phone and communicate with other members of the healthcare team. You will get feedback through this route. So let's say we need to finish our assessment on SimMan. We wanted to show you a few things that go on here. Obviously he can breathe. He has all the normal body sounds, heart, tummy, anything that you would need. The only radial pulse that he has is in his left arm, and you do need to push usually to get it started, and then you can count it and feel it just like you would. His right arm is only accessible for IVs. There is no pulse on the right arm. So those of you needing to use IVs can use his right arm. He does have femoral pulses you can feel, however he does not have any pedal pulses. If you need to take his blood pressure, you need to go ahead and take a blood pressure just like you would on anybody else. Place your stethoscope in the brachial area and listen for the sounds and report the results. Other blood pressure readings can be obtained by the touch screen over here. So some of you can touch the screen, start a blood pressure, and cycle it at timed increments. The other thing that the touch screen is showing you is a pulse rate. Shows you O2 saturations and other parameters that you may need for the scenario. So go ahead and use your touch screen when you need to find out information on your patient. The other thing that we want you to be aware of in this room is that we can put oxygen on the SimMan. You would need to go to your supply shelves, hook up the oxygen just like you would normally. However, to turn it on, you need to turn the dial on the side of the headboard, and then the oxygen will be operational. So you can turn it to what you need there. The other thing that you need to be aware of is how the bed operates. It's not your standard hospital bed. So you need to come to the head of the bed, grab the silver bar, and lift at the same time. And that will help you raise your bed up for your patient. And you also need to do the same to put it back down. Okay. But these are operational just like normal. Go ahead and grab, get the side rails down. So that is an overview of the sim room. What you're hearing now is the compressor cycling so that he can breathe, so get used to the noises in the room. But for the most part, the room looks like a hospital room, and we want you to take this seriously and treat it like a hospital room. The other thing you need to remember is each scenario will be different and have maybe different supplies or different names to the simulator, but be ready to participate. And that is all I need to tell you now about the sim room.